Hello and Assalamu alaikum. Ultrascan Diagnostics. Here, this is the CVCT of the patient that you had requested. The area of interest is the upper right and left wisdom teeth for evaluation. As you can see on the panoramic view here, we've got a BDR in the upper right tooth and we've got a mesioangular impaction in the lower right wisdom tooth. Now you can see on the transaxial view right here that this is the upper right wisdom tooth, which is a complete PTR. We've got a periapical radiolucency and a very thick bone supporting it on the buccal as well as on the lingual aspect. Now when we move towards the lower wisdom tooth, you can see that we've got a cavity in the occlusal portion of the tooth. As we move towards the middle of the root, you can see we've got good bone coverage. Something to be noted is that the tooth is very closely associated with the lingual cortical plate, and there is a very high risk for lingual perforation. We even have a little bit of lingual perforation in the mesial root, as you can see on this view right here. So this is something to be kept in mind during the extraction. The inferior alveolar nerve is significantly far away from the apex and should not pose any threat or any problem. On the axial view, you will be able to see that this is the impaction and we have a significant amount of tooth which is embedded into the lingual cortical plate, and hence there is a risk for lingual perforation that should be kept in mind. This is the axial view of the bottom, and then we will show you the axial view of the upper tooth. As you can see right here, that these are fused roots and should not pose any threats, as we have no pathologies associated with the impacted tooth. Thank you very much.